Hi, my name is Jamie Ale and I am a family nurse practitioner student at Maryville University, and this is my head-to-toe assessment for Nursing 6112, and Julie is the patient that volunteered to work with me. I started this assessment by asking Julie to empty her bladder. We obtained her vital signs, her height and her weight, and we also tested her faraway vision with the Snellen chart and her close-up vision with the Rosenbaum, and both were within normal limits. I'm first going to start this assessment with the head and the face inspection. I'm going to take a look at her face and look at the skin and make sure there are no lesions or swelling, and that the color is equally distributed throughout her face. I am looking for symmetry of the eyes and her eyebrows, and I am looking. I'm next going and looking at symmetry of her nose and her mouth as well. I'm going to palpate her skull, and I am checking to see that her scalp is freely movable and that I cannot palpate any indentation. There are no indentations or bulging in her skull, her head. And I'm also feeling her hair to check the texture and to make sure that it is not either too dry or too moist, and that she has no areas of hair loss. I'm next going to palpate her facial bones and going to palpate her frontal and maxillary sinuses and that they're not enlarged. And is there any tenderness when I do that?
Yep.
Okay, great. And then I'm going to palpate her temporal mandibular joint. And I want you to open and close your mouth. And when she does this, close your mouth. Is there any pain or tenderness?
No.
And then I also didn't notice any clicks or any extra noises. So that is also good. I am going to assess her facial nerve. So I'm going to ask her to clench her teeth, smile, wrinkle your forehead, puff out your cheeks, and then stick out your tongue, please. Okay, very good. And that just you can put it back in. And that just shows that the facial nerve is intact. And then I'm next going to test the trigeminal nerve, and I'm going to check light sensation over her forehead, cheeks, and chin. And then when I do this, I want you to tell me if the sensation is felt the same on both sides.
Yes. Yes. Yes.
Okay, and then I'm going to move forward with this exam, and I'm going to inspect her eyes. I'm going to look at her eyebrows and make sure that they are full in texture, the hair is evenly distributed and symmetrical, and that her eyebrows extend beyond the eye. I'm going to look at her eyeballs, and I'm going to look around the orbits, make sure that there is no periorbital edema, and that her eyes are symmetrical, and I'm going to, can you close your eyelids, please? Palpate and make sure that there are no nodules over the eyelids, and there are not. Can you open your eyes, please? And I can see that her eyes open and close completely, and her eyelids do, and that she has no ptosis. And then I can also, can you look up to the ceiling? I'm going to check her sclera and conjunctiva. Her conjunctiva are pink and moist, and her sclera they are white. And I'm going to start with a few eye exams checking for pupillary response. So I'm going to get my pen light, and I'm going to check for direct and consensual response. So can you please look towards the wall, and I'm going to check for her direct and then her consensual. Very good. Direct, consensual. Okay, now I'm going to do the cover-uncover test. Can you please cover your right eye and look towards the back wall, then uncover. And then do the left eye. Look towards the back wall, then uncover. And I can see that she has no strabismus, and both of her eyes are fixate on the object when she uncovers her eye. And then I'm going to check the 6 cardinal fields of gaze. So I want you to follow the tip of my pen light. And don't move your head. Very good. And I can see that her eye movements are smooth and coordinated, and that she has no nystagmus or strabismus again. And then I'm going to do the confrontation test. And so I want you to cover your left eye, and I'm going to cover my right. And can you stand up for me, please? So we're at eye level. And I want you to let me know when my hand is in your field of vision.
I see it. Okay. Okay.
Okay, now switch, please.
Okay. Now. Now.
Very good. Okay, if you could sit back down, please. Now we're going to move on to the ophthalmoscopic exam. I'm going to assess her red reflex. So I'm just going to look in your eye, and I'm going to assess for a red reflex. This is a lot easier if the lights are dimmed and her pupil is dilated. But I'm able to visualize the red reflex, and I can see the retina, and I can see the coloration, and I can see that her optic disc and the vessels coming too. And that is the normal color. And then I'm assessing her right one as well. And I can see her red reflex, and I can see the anatomical features of the eye, which are normal as well. Okay, and then I'm going to move on to the ear exam. I'm checking to see that her ears are in proper alignment and that they're symmetrical. And I'm feeling to make sure that there are no nodules or any lesions present. And I'm going to first, and there are not, and her ears are freely movable. And any pain or tenderness.
No.
And I'm going to do the whisper test. So if you could please cover your left ear, I'm going to whisper something to you, and I would like you to repeat it.
Apple.
Very good. I'm going to go over to your right ear and do the same.
Cherry.
Very good. Okay, and then I'm going to continue with the ear exam by using the tuning fork. And this tests air and bone conduction. And I'm going to do the Weber and the Rin test. So let me know. I'm going to put this at midline and the top of your head. Let me know if you can hear the sound in both ears equally, or if you can hear the sound in one ear greater than the other.
The sound is equal.
Great. And then I'm going to do the Rin test, and I'm just going to place this in the back of your mastoid bone, and let me know when you can't hear the sound any longer. Oh, I'm going to do that one more time.
I can no longer hear the sound.
Okay.
I can no longer hear the sound.
Great. Okay, so this test shows that the air conduction is 2 times longer than bone conduction, and this is a normal finding. Next, I'm going to observe the tympanic membrane by using the otoscope, and I'm going to pull her pinna up and back so that I can straighten the ear canal. And when I do this, I can see that the tympanic membrane is pearly gray, and that there are bony landmarks, and that there's no bulging or discharge. And then for time purposes, I'm not going to do the other end, but normally I would. And next, I'm going to inspect her nose. I'm checking it for size, shape, color, and symmetry. And I can see that it is symmetrical and that the color is consistent with her face. And so I'm going to check the patency of each nostril. Ask her to, will you please occlude one nostril and breathe in and out. And out. And then the other. And the findings are consistent with normal. They're normal because she was able to breathe in and out without any obstruction, and that shows that her nostrils are patent. And then I'm going to go ahead and check her nasal mucosa. So I'm going to check her I'm going to check the septum to see, make sure it's not deviated, and I'm going to look at the color of the nasal mucosa, and that it is pink and moist, and that there are no lesions or extra discharge, abnormal discharge, and that the turbinates are not swollen. And I would do the same with the other nerve, but for time I'm not going to. And then I'm going to now assess her mouth and pharynx. I'm going to look at her lips and see that they are full, pink, and moist, and that she doesn't have any cracks or fissures at the sides. I'm going to see, look on the inside and look at her gums, and that they are pink. I'm going to see that they are pink, red, and smooth. And I'm going to look at her buccal mucosa, her AP pillars in the posterior pharynx. And I'm going to, I'm going to have you stick out your tongue and then say ah.
Ah.
Very good. I'm checking to see that her, okay, you can be finished. I'm checking to see that her uvula is consistent with her soft palate and that it moves midline. And it moves midline with the soft palate, and that the color of the soft palate is pink and the hard palate is slightly white with a hard texture. And then can you please lift your tongue up to the roof of your mouth? And I can see that the vasculature is normal color and that there are no lesions under the tongue or any masses or bulging or any areas of crusting or discoloration. And everything is nice and moist. You can put your tongue down, please. And I also, open your mouth, I can also notice that her teeth are, she has all of her teeth and none are missing, and that the color is ivory, which is normal, and there are no cracked teeth. Okay, very good. Next I'm going, and I also notice that she doesn't have any extreme mouth odor. Next I'm going to check her neck, and I'm going to see if her trachea is midline, and which it is. So that's very good. And then I'm going to go behind and I'm going to assess her thyroid gland, and I will have you please swallow. And that I can see that her thyroid is regular in size and it's soft, and there's no nodules or masses. And when she swallowed, her thyroid gland went below my fingers, so that is expected. I'm also checking for trachea. I checked for tracheal alignment, and I'm going to check for her range of motion. So if you could please flex your head by turning it down. Now backwards, please, and now laterally to the right to your shoulder, and then now to the left. And then now I'm going to check resistance. So you can push against my hand, please, and now to the back against my hand, and then to the right, and then to the left. And then now shrug your shoulders, please. And now go against resistance with my hands. And that will be checking the spinal accessory nerve. Very good. Okay, now I'm going to palpate and auscultate your thyroid and carotid areas. So I'm going to palpate your carotid pulses. Okay, and they are strong and +2. And equal. And I'm going to auscultate it with the bell of my stethoscope. Take a deep breath in, please. And hold it, please. Very good. Now breathe out. We'll do that again for the other side. Good, and there are no bruits. And I also want to auscultate her thyroid gland and make sure that there's no bruit, because that can happen in a hypermetabolic state, and there's not. So next I'm going to have her lay back on some pillows behind her. This is at a 45-degree angle, and I want you to lay your head back a little bit. And I want to take a look at her jugular vein and make sure that it's not obviously sticking out or distended. So we're looking for jugular vein distension. And I don't see any pulsations or any obvious distension. Very good, thank you. Next, I'm going to assess her lymph nodes. So I'm going to assess the occipital, the postauricular, the preauricular, tonsillar, submandibular, submental, anterior cervical chain, and posterior cervical chain, deep cervical chain, and supraclavicular. And she has no areas of enlargement or tenderness, right? Okay, very good. So next I'm going to inspect her upper extremities. I'm checking for equal color and distribution, and I see that her extremities are pink and warm and dry. And I'm checking for tone. And I can also see that her nails she has brisk cut refill of less than 3 seconds, no clubbing or cyanosis. And I'm going to assess her brachial arteries and her radial. And they are equal and +2, strong. Very good. And I'm going to assess her muscle strength. So can you push up against my hands and down and push this way? Okay, and then outwards. Very good. And okay, so, and then I'll do the feet too as well. You can push up against my hands, please, and then push back against them. Okay, very good. And next, I'm going to inspect. Inspect the back and posterior chest. So if you could please turn around. Very good. Okay, thank you. So I'm going to inspect and palpate the skin of her back, make sure the skin color is uniform and that the temperature is even throughout, and I'm going to palpate and percuss her costovertebral angle. So I'm going to palpate this area and let me know if you have any tenderness.
No tenderness.
No tenderness? Okay, now I'm going to percuss it. Okay, no tenderness as well?
Nope.
Okay. And next I'm going to check for chest expansion, so take a deep breath in and out, please. Okay, very good. And what I'm looking for is that my fingers move symmetrically with her breathing. And I'm also, while looking behind, I'm looking at her respiratory effort and her breathing pattern and her rate, and making sure that it's symmetrical and even and there are no areas of noticeable distress movements. And I'm going to next check her diaphragmatic excursion. So I want you to hold, take a deep breath in and hold. And I'm going from resonance to dullness. And then please breathe out. And I would mark this spot. And then breathe normally a few times, like in and out. And then breathe out as much as you can. Okay? And I'm going to percuss up from this spot. And I can see that this area is 3 to 5 centimeters, which is a normal expected finding for the diaphragmatic excursion. Next, I'm going to palpate for tactile fremitus. So when I do this, can you put my hands on your back? Can you say 99, please?
99, 99, 99, 99, 99, 99, 99, 99.
Very good. Okay, and then I'm going to percuss her posterior chest and lateral walls. You can just sit like that normally. I'm going to percuss. And throughout this area, I'm expecting resonant sounds, because that's what the lungs should sound like. In any areas of a dullness or hyperresonance would be abnormal. Can you please raise your arms over your head, please? And I'm checking laterally as well for the resonance. Very good. Okay, thank you. You can lower your hands. And also, during this time, I'm going to auscultate both sides. So you can just breathe normally. I'm just going to take a listen. Okay, very good. Now I'm going to listen laterally. You can just lay like that, sit like that. And what I'm listening for is making sure that there are no extra sounds and that the air is moving in and out freely, that there are no crackles, rails, bronchi, or wheezes. Okay, very good. So next I'm going to auscultate her anterior chest. So could you please flip your legs around and face me to the front? I'm going to take a look at her anterior chest and check it for symmetry, size and color and shape. And I see that she has no increased respiratory effort and her respiration is regular, and that she has no pulsations or heaves. I also am, like I said, I'm going to auscultate the anterior chest and lung fields. Just breathe in and out normally, please. Okay, very good. Okay, and then I'm going to palpate her chest wall precordium for any thrills, heaves, or pulsations. So I'm looking for that, and she doesn't have any, which is a normal finding. And then I'm going to test her point of maximal impulse, and that is at the fifth intercostal space, mid-clavicular line. And then next, I'm going to test for tactile fremitus, again, on the anterior portion. So, can you say 99?
99, 99, 99, 99, 99, 99, 99.
Okay, very good. And I'm going to check her infraclavicular nodes and her axillary nodes. Okay, and there's no enlargement or tenderness. And then I'm going to percuss her lungs again systematically. On the anterior portion. And then I'm going to listen to her heart sounds. I'm going to listen to her aortic with the bell of my stethoscope, pulmonic, Erb's point, tricuspid, and mitral valve, and then mitral sounds. And what I was listening for is that S1 and S2 were heard, and that there were no extra heart sounds, beats or gallops or murmurs, and there were not. Next I'm going to inspect the abdomen. Will you please lay down so that I can inspect? So when I inspect the abdomen, I'm looking to see, you can pull your shirt up a little bit, inspecting to see if there's any contours, any pulsations or movements. I'm noting the flat contour and there's no bulging or obvious masses, so that's good. I'm going to go ahead and auscultate her abdomen and her bowel sounds and with the diaphragm of my stethoscope. And I can already hear bowel sounds, but this should really be done up to 5 minutes if they're not heard. And now I'm going to auscultate her arteries of the abdomen. So with the bell of my stethoscope, I'm going to listen to her aortic artery, left renal, right renal, left iliac, right iliac, left femoral, right femoral. And next I'm going to percuss her abdomen for tone. I'm going to just go across her abdomen, noting areas of from tympany to dullness. And the dull sounds signify solid organs, and tympany is some air-filled organs. And next I'm going to percuss her liver borders. So I'm going to start with an area of resonance, which is the lung area, and then I'm going to note that's the right costal margin, and then I'm going to start an area of tympany and go upward. And the finding is about 6 to 12 centimeters, And so that is expected. And then I'm going to check for splenic dullness. So take a deep breath in, please, and hold. Good. And I am looking for extra dullness or any bulging in the spleen, and I don't feel any, and that's normal. And then I'm going to, you can breathe out, I'm going to do light palpation of the abdomen, about 1 centimeter deep, to see if I can feel any bulging organs, masses, anything abnormal, any tenderness. No? Okay. And then I'm going to do deep palpation, and usually you can feel the organs, and at this point you will know if somebody is in any pain or they're having any issues, because this is much deeper. And then I'm going to check the right costal margin, palpate the right costal margin of the liver. So I'm going to palpate for it. Breathe in, please. Okay, and I can palpate the liver. And then I'm going to check her spleen. And at this point, you usually cannot palpate the spleen, so that's a good thing. It's abnormal if it's enlarged if you can palpate the spleen. And then I'm going to palpate her right and left kidneys. So, and the left is usually more difficult to find, but the right, you can usually palpate it, and the liver is sometimes in the way, but it's a little further. There you go. Okay, and so I palpate the right kidney, and now I'm going to check her midline for aortic pulsations, and there are no aortic pulsations. Checking her abdomen for tone, and I can feel that she has strong muscle tone. Next, I'm going to inspect her feet and skin and her hair distribution on her legs, checking for muscle tone and that her hair is even and that her legs are warm and dry, and that the color is pink. And then I'm also checking her pulses. I'm checking her post-popliteal pulses, and I can feel that they are +1 bilaterally, and her dorsalis pedis pulses and her posterior tibialis, and those are +2 bilaterally as well. And I'm next going to, and I also noticed that there was no edema. Can you please sit up? I'm going to check your reflexes. So I'm going to check your brachial reflex. You can just put your hand like that, and I can see that she, her reflexes are active. Same, and then I'm going to check her knee. Very good. And then her Achilles reflexes, Achilles tendon. And now I'm just going to, can you stand up please? I'm going to assess your cervical spine and lumbar spine. First, just stand up, and then I'm going to check that the cervical spine is midline and there's no deviation and symmetrical. And then I'm going to, can you bend over please? I'm going to check her lumbar spine, and that it is not curved, and that she doesn't have any signs of scoliosis or kyphosis. Okay, you can stand back up please. Thank you for listening. This concludes my physical exam for Nursing 612. Thank you.